Hello there, boys and girls. My name is Josh Northrup, and this is my final project for Sociology 101. The chapter I decided to go over was Health and Population. It's chapter 13. So I'm just going to give you a quick summary of what I've done. So at the top here, major health and population overview. At the beginning of each chapter, you should always look over your chapter objectives or knowledge objectives. That's basically what the author of the book is trying to make sure you understand. So as long as you can say something about each one of those, you've understood chapter content. So here you can see health and society is already open. There's also sociological frontiers for a better life, so on and so forth. So take a time and look through here. As we move down, we get into health and society. So the first one is a global analysis of health. The whole idea, the major takeaway of here is that the more egalitarian a society, the more equal a society, the better off it is for its citizens. So you can expect a longer life expectancy and a decreased infant mortality rate are the two primary factors that they use. Over here with social diversity in the U.S. health system, across the board, all the old studies focus on white middle-aged males. So that was great when science was only run by white middle-aged males, but with the influx of minorities and women, we're starting to realize that that's not quite enough. So a lot of our studies, and I'll talk about that more later, a lot of our studies now are dedicated on anybody else besides that small demographic. So, for example, certain medical conditions affect certain races more than others. That's now being studied more and with higher indexes of suspicion from certain doctors and medical facilities. As far as basic epidemiology, this is just the study of disease. It's the study of how it's formed. It's the study of how it's transmitted. Basically, how did typhoid Mary infect people? How did a cholera outbreak happen? That type of thing. So basic overall of what's going on there. When we start getting down to AIDS, there's a huge distinction between HIV and AIDS. HIV is the human immunodeficiency virus, and AIDS is the acquired immunodeficiency syndrome. You can't catch AIDS. It's impossible. You can catch HIV, and as soon as an opportunistic infection, which is an infection that would normally be fought off by the healthy individual, now takes hold and becomes causes an HIV person to become sick, you are now classified as an AIDS patient. AIDS has been kind of stigmatized as something that affects drug users and gays throughout history, but now that celebrities, heterosexuals, different people are starting to come down with AIDS, and there was a big influx in the 80s and 90s from blood transfusions and different reasons. It's now becoming more mainstream, and with the prevalence and the push for gay marriage and equal rights, more studies are now going towards AIDS because the stigma that's prevented that has now gone away, or at least going away. As far as smoking, stop smoking. If you smoke, you need to stop doing that. It's basically killing you. So just make sure you stop smoking. It's a good life lesson. If nothing else, smoking is a huge preventable factor in most medical conditions, most medical problems. So as we smoke, we take days, years, months off of our lives. So just remember, every time you're smoking a cigarette, you're taking days away from your children spending time with you. So please stop doing that. I've dealt with many patients that were sick, dying, purely because they decided they were going to smoke. So stop doing that. It kills lots of people. 430,000 people. It's 13 times more than HIV or AIDS. As far as how AIDS has changed America, I talked about that briefly. Again, that was the celebrities. Magic Johnson's a huge one. Rock Hudson's another one that were HIV positive, and it kind of brought to light that celebrities, not just drug users, not just homosexuals, not just these at-risk populations, can come down with HIV. So it's now moving in more into the political arena and more into common usage. As far as obesity, Americans are fat. Everyone's heard the moniker, the fat American. The problem with that is that it's not just how you look, it's how you live. When we start talking about obesity, it's one of the largest comorbid factors. Comorbidities are things that exacerbate other problems. So if you're overweight and you smoke and you have previous heart conditions, you don't have a very good long-term outlook. So obesity is a huge deal. And with Americans in general, we are trying to get away from poor lifestyles. That's why there's all the no smoking campaigns and the Get Up and Move campaign by Michelle Obama, and just different things that are helping us to try to hopefully fight this big obesity epidemic. It's great if there's not a self-esteem thing associated with it and a look thing associated with it. Purely on a health basis, you should not be obese. Obesity is when we start talking 20 to 30% over your target body mass index. That's just unhealthy, and that leads to shorter lifespans and more medical conditions. As far as basic medical care in general, with the medical professions, in the old days, doctors started off as barbers who did quack medicine and bled people with leeches. Then they became basically the height of all respect in the career realm. And now, thanks to WebMD and Dr. Google, it's starting to drop off again as far as the respect for doctors. Just be aware that a social media post does not equate to an 8-year medical degree and residency. So, just as an FYI. As far as sexism in medical research, it's already been shown a few times throughout this course, but white males apparently dominate all of science, or at least have for the last few hundred years. So when we start talking about sexism in medical research, everything was based upon the middle-aged white male, but certain things don't apply to that. Heart attacks, for example, men have crushing substernal chest pain going to their left arm. They feel nauseous. You guys have all seen a video or a movie where the angry boss has a heart attack and grabs his chest and collapses. But with women, they have back pain, they have shortness of breath, they feel a little dizzy, they just don't feel right. So now more science is being dedicated towards women, towards elderly, towards people outside the realm of the stereotypical white middle class male. A lot of studies now are not being funded, and a lot of research grants aren't being given if people aren't including women, minorities, different age groups, different socioeconomic classes in the studies. They're being banned from getting their funding. As far as social diversity in medical care, the same thing applies. If you have the money, you see the doctors. If you don't have the money, you wait till you don't have a choice. So it's very rare that the young urban male who's barely making a living is going to go in for preventative health screenings. But if you're in your mid-60s and you've had your third home purchased, you got nothing else to do, so you go see your doctor for preventative medicine. I worked down in City Heights in San Diego on the ambulance for many years, and I would pull people off death's doorstep on a regular basis for basic things like asthma, for emphysema, for heart conditions that regular preventative maintenance, regular preventative medicine would have kept me from going there. So the idea there is if you don't have enough money to go see your doctor, you just wait until it becomes an emergency. It exacerbates the whole system. So we're not going to get into that because that leads right into the high cost of healthcare. One of the major problems is that the people that use healthcare generally can't afford healthcare. The people that can afford healthcare and have insurance generally don't need all of their insurance because they do crazy things like preventative maintenance. It goes in the history of time that an ounce of prevention is worth a pound of cure. That's the whole idea behind the new healthcare system pushes. Everything is based upon the insurance and the red tape, and that just brings up the cost. Anytime you add 4 or 5 more middlemen, the overall cost goes up. As far as the sociological perspectives, I want you guys to look through here and actually see the 3 different perspectives. But as a generalized thing, the functionalist perspective focuses on the positive functions of sickness in society. How does society actually see sickness? As far as the conflict perspective, always causing trouble, looks at the negative side of healthcare and medical care. And then the symbolic interactionist explores the interaction between doctor and patient, and then the roles in which each one plays. So there's more specifics as you guys hit the little pop-out menus. So please take a look at that stuff, or go back up and take a look at that. As far as the global analysis of population, how a census is taken, generally census is taken by mailers, or it's taken by people going door to door and just doing a survey. Also the same guy that stands in the mall that we know we don't make eye contact with, a lot of times is the Census Bureau. As far as population growth is aggressive. In the United States, we're gaining a person every 16 seconds. according to the Census Bureau. Whether that's from immigration, from births, or lack of deaths, we are gaining new people every 16 seconds. So our population growth is fairly healthy here in the United States. As far as birth rates, generally the poorer the person, the more kids they have. Yet if it costs money to support children, so a lot of the upper class, a lot of the middle class people realize that, so they can't support the children and maintain a lifestyle. When we start talking about more of the agricultural, lower socioeconomic class families, more kids equals more help around the farm, around the house, around the homestead. So more kids are better off. Plus, in a lot of the other countries of the world, they're hedging their bets. They expect their children to pass away early and often, so they have more because of the attrition rate of those kids. So that's where the birth rates come in. As far as the death rates, sorry about the grade background, it was being weird. As far as the death rates, the more developed the country, the better off you are, as crazy as that sounds. The longer you live in a more developed country. So if you are in sub-Saharan Africa, your life expectancy is in the 60s years at best, if not younger, where infant mortality rate is right up about the same. You got 49 to 60%. Whereas you go to United States, you go to Mexico, you go to Canada, you go to any North American countries, European countries, life expectancy is 70s. In some, like Japan, it's in the 80s. And infant mortality rate drops off drastically. International migration, people are flowing over the borders left and right to every country. There's lots of migration. Generally, people are fleeing from bad and trying to go to good. So US, all of North America has a high immigration rate. Europe has a high immigration rate because people are fleeing wars, genocides, persecution, and they're going to where they want to be. So that's the whole idea behind international immigration. As far as age, gender, and marriage, big thing here when we start talking about age groups is that all of our baby boomers are starting to die off, or they're starting to age. So we have a generalized youthening of our population. As far as the sex ratios, this is the difference between men and women. In societies, we generally have more boys, but boys also die more than girls. So when we start talking about countries like China, India, there's a benefit to the family to have a male, but males also die more often across the board. So generally, most areas are basically even out between males and females over time. Some countries aren't, and that leads to some big problems as far as marriage rates. As far as marriage rates, as even and equal as marriage rates can be, where if everybody is married, it increases our birth rates. Statistics show that a married couple will have and maintain more kids than an unmarried couple. So as far as the patterns of population change, the Malthusian theory is basically saying that people fight because there's not enough food. So as populations grow, two people have kids. Each one of those kids now has kids. Each one of those kids now has kids. And you have an exponential growth from the starting point. Whereas food, you can only grow in a linear fashion. Every square foot of food only makes X amount of food. It doesn't then grow another X amount of food. There's not an exponential growth. So that leads to lack of resources across the board in history of time. Lack of resources leads to strife, war, disease, poverty, and all the other things that history has shown us. As far as the demographic transition, there's 4 stages. First stage, birth rates are high, as well as death rates. And this basically helps us to kind of cap as a stopgap measure and slow down the exponential growth of a society. As we drop off from there, birth rates still remain high while the death rates start to drop off, and this is where we start to grow. This can't be sustained, so now the death rates start to decline as well as the birth rates, and that's going to help us to get closer to a normal baseline population rate. And in the 4th stage, this only happens in very developed countries such as America, China, Japan, certain places where it's very urbanized and very industrialized. You start to see even a negative growth where the birth rates have now been surpassed by the death rates. and it's completely evened out and can even start to drop down. So this is just the basic flow, the ups and downs of how society grows. As soon as you start having less people, people realize there's more resources, so they start to grow. As soon as people grow too much, they start to realize there's not enough resources, and people start to die off, and back and forth. As far as the demographic fallout, it's simple as too many people leads to not enough of anything for anybody. Africa is an example the book uses, where half of its economic expansion and economic income is used purely just to maintain subsidies for its society. So that's not going to growth of the nation, infrastructure. It's just basically making sure there's rice on a truck going to the villages. So that leads us to some problems in overall growth of a country or nation. When we start talking about population growth, there's really two types. There's voluntary and compulsory. Voluntary is as it sounds. People decide whether or not they want to have kids. But for this to work, there has to be some type of incentive for them to want a small family. So in certain cultures, they get benefits, they get raises, they have free college for their families, things of that nature, as well as just the society looks at them the same. If you guys have friends or family that have 4 or more kids, you look at them and you think, wow, that's weird, because the average American family of 2.25 kids is what we expect to see from people. As far as compulsory, this is where there's jail sentences, forced sterilizations, fines, huge family and political and social stigmas associated with having too big of a family. As far as U.S. policy, birth control is available, it's abundant, it's free if not low cost, pretty much everywhere in the country. We have to wait and see kind of what happens. During the Obama administration, there was huge funding for Planned Parenthood. Now that Trump's in office, we'll have to see what happens there. But birth control itself is still available to everybody all the time. Generally, you just have to talk to a doc first. As far as immigration, immigration's a big deal. We have lots of people. Again, 26% of our nation's population growth is due to immigration. Again, we're getting one person in our country every 16 seconds, and we're getting an immigrant into our country every 33 seconds. So that's kind of a big flow of human beings into our country. As far as the impact of immigration, every country has stereotypes and has preconceptions about immigrants. America was founded on immigrants. The whole idea of the Statue of Liberty, the poor, weak, and hungry, send them in the masses. The problem that we've run into is that people are getting into the legalization of illegals. Amnesty has been shown to work where those that are already here are made legal, or they're given the means to legalize. If that's unavailable, then they have to go about another way. Across the board, amnesty has not been shown to increase illegal immigration. The problem with too many illegal immigrants is that they are a tax and a drain on the system without paying into the system. If you're an illegal alien, you're not going to be paying taxes. You're not going to report crimes. You're not going to do the things that normal citizens that are here legally will do. That's where amnesty comes in, make them legal so that way they can help the system. They're already here. It's impractical to send 20 million people out of the country. So that's where the fine line is. Immigration is great. Legalizing or making legalization easier is the key, and we'll have to wait and see what happens with that. But that's all I have for you guys. That's a quick little review and a rundown of the chapter. Hope you like it. Please go back and click around. Have a great day.